Hi, everybody. Patrick Stiles here with CBD TV, and I have with me Dr. Kornfield, who's on the medical advisory board for one of our companies listed on CBD.co, Canbiola. Dr. Kornfield, how are you doing?
I'm good, thank you.
Excellent. Well, thanks for joining us today. And to dive in here, why don't we start with talking a little bit about your background and how you came to be on the medical advisory board for Canbiola.
Okay, it's a slightly long story, but I'll try to make it short.
Yeah, it's fine.
Okay, I started my career doing mostly reconstructive foot and ankle surgery. And over the course of years, I began to realize that there was a lot more to the surgical experience than just my expertise and my technique. It had a lot to do with who I was operating on and at what time of their life I was operating on them. So I started getting much more concerned about how to minimize problems and complications and make the outcome as good as I could. That led me more to trying to understand how the human body heals, how the human body recovers. That brought me into a much more holistic orientation. And as time went on, and I was following a more holistic approach to dealing with these patients pre-operatively, I was finding many of them never actually wound up in the room because they were healing. So
Wow.
my orientation is always now to support the body in its mechanisms so it can find its way to its natural state of healing. And as such, my practice evolved into the much more chronic pain-oriented aspect of foot and ankle care. Because I have patients coming to me that have been through 10, 15, sometimes 20 or 30 doctors and haven't gotten the results that they're looking for. I met the Canbiola company at a music festival. So I wanted it to make sense why I walked over to them to talk to them.
Okay.
You know what I mean?
So you were at a music festival and you saw the Canbiola booth. They were there exhibiting and you were like, hey, I need to find out more about this CBD stuff.
Actually, no.
Okay.
I saw the Canbiola sign and my girlfriend said, oh, that must have something to do with cannabis. And she was interested and dragged me over to it.
Okay.
And I didn't know that they were about cannabis. I just saw Canbiola, didn't know what it was.
Yeah.
Started speaking to Marco Alfonsi, who's one of the main principals of the company.
Yeah.
And he was telling me all about it. And I was very familiar with the medical marijuana part of dealing with pain syndromes, but I hadn't really interactions on the CBD, pure CBD, as a method of healing people. And we were talking for quite a while, and everything he said to me made sense biochemically. But I said to him, you know what, I have arthritis. Why don't you give me some samples and I'll take it home and I'll check it out for myself. Yeah. And if it makes sense for me, it'll make sense for my patients. Okay. And it took away all of the arthritic pains I was having in my hands and almost all the arthritic pains in my knee. And I had been dealing with it on and off for quite some time. So I was quite impressed with the result. And that's what made me call him. And I just really wanted to work with them in terms of supplying it to my patients, not knowing that this is a company that's really taking off in a very big way. Yeah. So they have a pretty big medical advisory board. There's a bunch of doctors. After speaking with me for a while, he says, you know, if you're interested, we need as much help as we can get with physicians who are in the trenches dealing, you know, with patients on a daily basis. So, you know, if you want to join us in that regard, you know, we'd be happy to have you on board. And of course, I was more than happy to do that.
Wow, that's such a great story. I love it. All right, so let's talk a little bit about some of their products because I have a couple of them right here, like the Nano Pure Ultra hemp oil drops.
Okay.
And I like these a lot, and I was really impressed when I came across the Canbiola products because one, it's a nano. And could you explain to the people watching this what makes a nano product so great and why you would even want that?
Well, the key to using any kind of healing modality, whether it's pharmaceutical or natural, is its bioavailability, meaning how well does it get into the cells and how well does the body utilize what it's chemically supposed to do. I think over the course of time, this nanotechnology has been getting more and more play because the smaller the molecule, the easier it is for it to get. What I've been watching with a lot of the CBD products is they have things down to around 100 nanometers. Canbiola has it down to 30. So that's a huge difference in its ability to get in and be utilized. And also, of course, because of the way CBD works by binding to certain receptors in the body, it has to fit. So there's a tremendous efficacy with this nanotechnology, and the smaller it is, clearly the better it's going to work on the system.
That's cool.
So, yeah.
And you guys have a very interesting way of creating the nanoparticles. Is that right?
Yeah, the actual chemical process I'm not totally familiar with.
Okay.
That may be something that we can certainly get answers for. However, what I will say is that whatever technology they're using now, I don't see anybody doing this on any level. And I've been researching a lot of these. So I'm sorry I can't supply you with that particular answer, but
that's fine. So the story that I heard when we were first kind of like courting each other and talking about getting Canbiola products on CBD.co is that sound waves are used to break apart the molecules into the smaller sizes, which just kind of blew my mind of how you could even use a sound wave to break down a particle size that much, and it seems like, maybe this is something that we can do in a follow-up series, but it seems like that would have much fewer solvents or kind of trace materials if you're using like emulsification or other things. So it seemed like very advanced technology, and I just kind of love that mechanism of, creating nanoparticles with sound waves.
Well, everything that Canbiola is doing is to ensure that there's purity to the product. They're using nothing inorganic. All of their products are organic. They're sourced locally. They're growing in Oregon. The manufacturing plant is in Seattle. There's nothing unnatural in any of their products. So, what I discovered in trying to deal with this aspect of my practice is so many people were afraid of medical marijuana because they were afraid of the psychoactive component of the THC. And CBD supplies so many medical benefits without getting people stoned. And it's been an impediment to a lot of patients who didn't want to go that route. And with CBD and with Canbiola CBD, there may be traces of THC, but probably nothing compared to a medical marijuana product, and certainly well below the threshold for considering it a medical marijuana product. So there's no high from these medicines at all.
Right. Yeah, and that would be the 0.3%. That's the federal limit of THC in products. And of course, like this is some of our due diligence before we have products come onto the side of CBD.co, because we look at their COAs and their processes, and we want to ensure that we're having good products on there, and that's kind of part of our promise to our customers and everybody on the site. So yeah, that's fantastic. So which products do you use in your practice? Is it the NanoPure Ultra? I have a few more. These are, so this is another NanoPure Ultra, but it's in a spray. And then, of course, you guys have a salve here. So does this have honey in it?
It has beeswax.
Beeswax, wow. It smells incredible.
Yeah.
Yeah, it smells almost minty fresh or something like that. I don't know. It's just very delightful.
Well, there's some lavender in it. There's some lemongrass oil in it. There's beeswax. I think that most of it is sourced from coconut and beeswax.
Wow, that's good.
But I've been using the 1500 nanometer product, the 1000 nanometer product, depending upon the level of my patient's pain.
Yeah.
But one of the things I think is important for people to understand, when you're looking to these products for pain relief, you kind of have to understand the biochemistry of how it acts in the body. And what we're doing with CBD is really stimulating and opening the pathways of primary inflammation, which is the pathway of homeostasis. So I don't really look at it in terms of immediate pain relief. I look at it in terms of how do we get the body to detoxify and repair more efficiently. So I, of course, tell my patients, please be patient with the process, because if you stick with it, you're going to notice tremendous change. It's not like taking a drug and saying, oh, this drug gave me pain relief immediately or in 30 minutes or 45 minutes. We're looking for the long-term activity on how we can make changes in the immune system to make it more efficient. And that's the beauty of CBD.
That's really cool. So let me see if I understand this correctly. A traditional painkiller, I think most of them are opioids, kind of like heroin or morphine, things like that.
Right.
And they reduce pain by actually just blocking that receptor in the brain.
Exactly.
And that's why you get that drowsy, almost drunk-like feeling. If you ever take them, you can't operate heavy machinery. But what you're saying is that with CBD, and especially Canbiola's products, is that they basically modulate the inflammation mechanisms in the body, which in turn brings down maybe swelling and inflammation and pain throughout the body naturally and over a long-term process, so that it happens that naturally. That pretty much it. Okay.
Because the way the immune system works, when we fall asleep, we go through processes of detoxification and repair. And when those pathways are efficient, you don't even know you have a problem because you won't have symptoms. Symptoms occur when the body's struggling to detoxify and repair efficiently. And it will default into the pathway of chronic inflammation. That's the pathway of pain, of swelling, of all the different diseases and degenerative things that we see over time. Wow. Drugs will suppress chronic inflammation, but they also interfere with the primary inflammation, which is the primary way we stay in homeostasis. So why add more toxicity to a body that's already having trouble detoxifying? What the CBD oil does is it stimulates these receptor sites, which are naturally stimulated by our own endorphins and neurotransmitters, and open up this pathway. This pathway is essentially huge because it affects sleep, it affects the way our adrenals work, it affects the way the immune system goes in to change and repair cells that are injured or dying, and it has many different aspects of how it affects the brain. So we see changes in the way people are developing seizures, anxiety, sleep disorders, and pain. I've seen it on all of the patients I've prescribed this to who have had these issues long term. And it's a truly profound way to manage someone that's been struggling for a long time, because we don't have to field side effects.
Wow.
And that's the biggest issue for me.
Yeah. No, that's huge, right? Because every drug out there is going to have side effects because it's a synthetic, unnatural process of kind of manipulating the body into what it's trying to achieve, right? But then in the process, kind of what you're saying is it kind of causes other things to happen that as a, well,
it's a support rather than a suppression. You know, and the human body's not
That's a good way.
If you try to suppress a pathway, it's going to figure out a way to go around that suppression. Those we call side effects, but they're really not side effects, they're effects. We know they're going to happen.
Right.
It just depends on at what point in your therapy it's going to happen. And because everybody is physiologically unique, drugs affect different people in different ways. Whereas the CBD issue, because it's working with the body rather than against it, you know, there really isn't any side effects. And with this nanomolecular technology, the particle size is so small, it doesn't leave a bad taste when you put it under your tongue. It's pleasant.
Yeah.
You know.
Yeah, there's actually some sweet taste to it as well.
Exactly.
That I was trying before it.
Yeah.
Right. So do you use the salve as well, or your go-to is the tinctures?
I use them together.
I
use them together because, as you well know, the skin is the largest organ in the body, and it houses more toxins than any other spot of the body. When we're working on these pain syndromes, we have patients take it orally and apply the salves locally, and I find that's the best efficacy of our approach.
Got it. So it's like a 1-2 punch to it.
Yeah, exactly.
Yeah. And then have you been using any of Canbiola's pet products much in your practice?
As a matter of fact, it's interesting. I mean, obviously I treat human beings, but
right.
My son has a young dog, 4-year-old pug that was born with deformed legs.
Oh, wow.
And at the age of 3, developed arthritis in his knees. Then they had to keep taking him to the vet. He was refusing to walk. He was always in pain. They had him on anti-inflammatories. He got internal bleeding from it. Oof. And then I met the Canbiola company, and I offered my son to try the CBD for pets, which he did. And this dog is now jumping up and down off the couch and having a great time at the park. So we know it works for pets as well.
Oh, that's cool. And, you know, that's really interesting because with a dog, there's probably not as much of a placebo. I'm not sure if you're familiar with any studies like this, but the dog's not like, oh, this is for my pain. You know, he's eating treats and snacks and food all day long. He doesn't really know the difference.
Right. Well, I'll tell you, in the world of holistic medicine, not that CBD is a placebo, but in the world of holistic medicine, when someone reports that they're feeling better and you think it might be a placebo, it's still a good effect.
Right. Yeah. I'll take all the placebos I can get.
Exactly. You know, the mind is a powerful tool.
Right. Yeah. That's interesting. So that's really cool. All right. And then so now Canbiola is a public company. Do you know their ticker, by the way?
CANB.
CANB, if anybody watching at this wants.
And the fact that it is a public company should tell guys about the dedication that these guys have to making this a really viable company.
Yeah. Oh,
And,
that's totally true. I can
yes, and
attest to that.
they're working really hard at developing better products, better technology, and they're trying to get the word out as best they can. That's part of my role on the medical advisory board. I go and speak at conferences for them, and I've been writing some articles for them, and they've been sending me patients who find them through their website who may have an issue or problem that I specifically treat. So, you know, it's a fast growing industry for sure.
Yeah.
And I think more and more doctors are going to jump on the bandwagon.
Yeah, absolutely. And I mean, I view that as one of the biggest positives with the legalization of marijuana, even recreationally, even though that's like the other totally different side of the industry as far as cannabis goes, because, you know, hemp under, you know, the Farm Bill and the importation of hemp bill, you know, CBD is legal if it's derived correctly, you know, from a hemp thing. That's our understanding of it. That's our lawyer's understanding of it. There's different opinions out there. But anyways, that means that it's legal in all 50 states, if that interpretation is accurate.
Right.
And, but there's still this stigma, and it's kind of the thing that you were talking about where people, you know, are maybe kind of hesitant about it, or, you know, doctors or anything like that. You know, I know that, you know, friends and family that are outside the industry, you know, as I work inside this one, they're, you know, they're like, well, is that marijuana? Do you need licensing? Like, how does this work? And there's a lot of kind of just lack of education and awareness with the public. So as we see this huge tidal wave of social change, you know, starting with, you know, medical marijuana and recreational legalization, and then products like CBD, I think that there's going to be widespread adoption of it. Yeah.
Clearly there will be, because right now we have, as you well know, an opioid addiction problem in this country.
Yeah.
And stemming the tide on this addiction issue is really critically important. A product that does not cause liver damage and kidney damage and overdosed fatalities makes perfect sense.
Right. Yeah. All right. So that leads me to my last question. Where do you see the industry going in 2018 and beyond?
Well, I think probably the number one thing that the industry is doing now is getting public recognition of what they're doing, marketing these products so that the people understand that they're not going to get high. They're in no danger of getting arrested or, you know, winding up in a fatal car accident because they're stoned out of their mind. None of that happens with CBD. So I think that's part of where we're moving. We're always going to run into issues with big pharma. You know, they like when people are in pain. They like when people have to take Vicodin and all of these other drugs. So there's going to be some issues that we'll have to face in terms of a face-off, which in the world of holistic medicine, we've been doing this for a long time. But the public is the ultimate decider. So once the public gets the education and they learn about these products, they can bypass the whole, you know, issue of getting a prescription for their doctor because they're not getting stoned. It's perfectly legal. They can get it over the counter. And once they understand what it's all about, I think we're going to see more and more people looking for answers through this whole industry.
Yeah, that's fantastic. Well, thank you so much, Dr. Kornfield, for coming on the show and talking about Canbiola. It's been a pleasure. I've learned a lot. I hope the viewers at home or wherever they may be, you know, did as well.
Okay, thank you, Patrick. Nice to speak with you.
Take care. Bye.